Hi, Lauren.
Hi, Daniela. So I am Lauren Holder. I will be 39 in 4 days.
Wow,
I am gene positive and live in North Carolina. Longtime patient advocate and member of HD-CAB and HDO ambassador, and do a podcast for the HD community.
perfect. Uh, so you're participating in HC Blog talking about clinical trials, and you
Yes.
participated in observational studies as well. So observational and the, sorry,
Clinical trials.
yeah, so observational studies and clinical trials, right?
Yes, I've participated in both observational studies and clinical trials. The difference being that observational studies don't involve a drug that you take, and clinical trials involve an actual drug that you would take.
Yeah. How did you take that decision to participate? Maybe the observational study is not so invasive, and the other one is a bit more. So how did you took that decision to participate in both?
Um, I tend to be like a major advocate of participating in research. I've always participated in research from the time that I could. I started, I think, with Predict HD, which was looking at pre-symptomatic people in an observational study, doing scans and all kinds of stuff. And it really just piqued my interest. And so I started participating in observational studies, kind of everywhere. So I've done like exercise studies for HD. I've done Prevent HD, which is another pre-symptomatic observational study. I've participated in Enroll. And then when I got the opportunity to participate in a clinical trial that was looking at more cognitive side of symptoms, yeah, I mean, I was really excited to be able to kind of look at the other side of HD, not just movements.
Yeah, that's great. It's great that you feel like you have to do something active inside the community to kind of also for yourself and for the others, which is great. How did you feel during? So it's a tough decision, I believe. And so how was it, especially the clinical trial? How did you feel during the clinical trial?
So it's interesting because I always compare it to observational studies that I participated in, which were very hard to get to personally, just because you have to arrange all the travel and there's reimbursement. Not everybody has money to pay up front for flights and things. So I always found it a little bit hard to navigate all of that. But for a clinical trial, specifically the one that I was in, they offered they had a liaison service, a service where they did all of it for you, and they booked everything and took care of costs, and there was very little having to do reimbursement. And so that made it a lot easier as far as traveling goes. A lot of the clinical trials are going towards that, and that's awesome because that's definitely what we need for the HD community and not something we've seen really until recently. Um, that really cut out a lot of that stress, just having somebody to manage all of that, and not having to do it myself. Uh, I would say, as far as participating, anytime I'm participating in anything, it's tiring. I'm using my brain. I have to use so much more energy for my brain to function like it is and like it was. And so it's very tiring afterwards, and I always have to sleep. But that's another great thing, is letting, the center know, like, I need to stay an additional night because I need to be able to rest after my visit. And we've learned these things about me, like, don't push me as far as that, because I've ended up in the airport kind of just walking around, not sure where I was going because I was so tired. So, um, that's why it's good to kind of stay an extra night and make sure that nothing happens. But overall, my experience has been very positive in both the clinical trial and in observational studies and getting to participate. It's very tiring, but it's very rewarding, just to be able to feel like I am part of the solution, I guess, and to really try to help move research forward.
Yeah, I was going to ask that because afterwards, what do you feel like? You feel like more empowered in some way?
I
Like,
do.
that's
I
great. Yeah.
do. I feel so much more empowered, just because, you know, we are at a critical time in HD and getting into research earlier in HD and making it before we get to, bad symptoms. It's really critical time for us. And so to be part of that solution and to be able to kind of help in that by participating is kind of it really is very empowering.
Do you have any like advice or maybe encouraging words for people that are kind of uh, scared of going into a clinical trial? I know it's of course a personal decision and it will always be, but maybe there's something you're willing to share that may help people to be more relaxed and more eager to participate in this.
Absolutely. I think the first thing to know is you can always walk away. So even if you start something, there is nothing that says you have to keep going. And so if at any point, whether it's a clinical trial or an observational study, if you feel uncomfortable, you have the right to walk away. And that's huge, right? Because I think we get in this mindset that, oh, we've got to do this, right? Because they need it, they need it, they need it. It doesn't matter. If it's not right for you, it is okay to walk away. And it's okay to stop and it's okay to tell people that, like, no, this is too much. Don't be afraid to stand up for yourself and say, I need that extra night. If you are participating in something and you know that you're too tired to travel, don't be afraid to say, I need that extra night because they need to know that as well. That's part of it. They need to be documenting that. And always know that if you're looking for information about something, there is somebody in our community who is willing to share it. We have a ton of people who are knowledgeable about research, who can educate you. You can call different centers, and their research coordinators are amazing. And they literally know everything about every study, and they can tell you the pros and cons for you. I mean, everything. So I highly recommend speaking to a research coordinator at an actual site of whatever observational study or clinical trial you want to do, and get to know them and get information from them, because they're going to be able to provide more information than anybody else, not the sponsor, not pharma. Those research coordinators know it all. And so I swear by them. I think they are incredible and a wonderful resource.
Great. And now talking to the other side, do you have any advice for these entities that are responsible, like the pharma companies and these studies, the organizers, how they can better accommodate the patients for this? Do you have any advice?
Yeah, one of the things that I'm seeing, you know, as part of HD CAB, as part of, just being involved in research, is the sponsors, the pharmaceutical companies, are finally asking our opinion and they're wanting to hear more. And that's huge. Keep doing it, guys. It means the world to us that you are asking our opinions and that you listen. And I've experienced that firsthand from pharmaceutical companies we've provided feedback, and things have been implemented. And it is so good to see that. And that's what we need. We need to know that our voice matters and that we have a seat at the table. So continue to provide that, because we are how we get to the cure, right? There is no research, there's nothing without the people with HD. And we can't get to where we need to be without the researchers. So we have to work together. We have to collaborate on all of it from the beginning to the end in order to get to where we need to be.
Yeah, thank you. That's great, great words, Lauren, as usual. Do you have anything else you feel like sharing, or you think it's important to share or to say to the community? Anything else?
Just hold on, guys, and keep speaking up. Realize that right now our voice is very, very powerful. And right now is our time to really speak up, and especially when it comes to research. So don't be afraid to speak up. Make sure that you're fighting for yourselves. Don't be afraid to say, no, I can't do this, or something's not okay. It's okay. Don't let people pressure you into doing something you don't want to do, but realize that you have a choice. And if you choose to do it, you don't have to be scared. there's tons of information, and at any point you can say, no, I'm done, I don't want to. So we work together, and we get through this together, and we have to keep fighting and keep being loud. I love you guys.
Lauren, thank you so much.